Good morning, everyone. My name is Dr. Tara Egan, and we are here today to talk a bit about ADHD. And there is a whole bunch of information that we could talk about in this topic, but today we're going to limit our webinar to discuss what the definition of ADHD is, some risk factors to consider, and some potential treatment options. So we're going to get started. Just to remind you, once again, my name is Dr. Tara Egan, and I own a private practice in Charlotte, North Carolina, and I have licensure as a mental health clinician. I have a doctorate in school psychology, and my primary areas of focus include supporting parents as they attempt to manage technology and social media in their families and with their children, as well as supporting families as they navigate through separation and divorce. And in the process, I work with a lot of families who have overlapping, both those issues overlap. And then I also work with a lot of kids with anxiety, which is how this topic is relevant to what I do, is because kids with ADHD often experience very anxiety-provoking situations. And with my training as a school psychologist, that is a really common topic that we discuss in the school district. And we have to work to support students with ADHD on a really consistent basis. So let's talk a little bit about what ADHD is. And you could look up a billion different definitions. But for the purposes of today, we're going to stick to the definition that is most traditionally used. So it's important to recognize that ADHD, which is also known as attention deficit hyperactivity disorder, is a neurological disorder. It's very complex, and it's characterized by three core symptoms of inattention, impulsivity, and hyperactivity. And so from those three core symptoms, we can diagnose ADHD in a couple different ways, where some kids might experience just the inattention part. Other kids might struggle with all three of them, where they struggle with attention, but also struggle with overactive behavior and impulsive decision-making. So we're going to talk a little bit about each of those. I do want to note that according to the Center for Disease Control, ADHD is one of the most common reasons for a child to be referred for support services in school. And it affects approximately 9.4% of children in the US. So as a former school psychologist, I certainly can attest to the high number of kids who exhibit symptoms of ADHD, and it can interfere with their progress in the classroom setting. And as the adults in the building, as the educators, it's up to us to try to make the learning environment more accessible for these kids so that they get to benefit from not only the academics, but the social aspects of school also. When we break down this number, we see that about 2.4% of young children are diagnosed between the ages of 2 and 5 years, 9.6% of school-age children between the ages of 6 and 11 years, and then 13.6% of adolescents aged 12 to 17 years. And there are certainly a number of adults who are diagnosed with ADHD as an adult, but today we're going to limit our discussion to talking about how it relates to kids. Some risk factors that I want parents to consider is, and as clinicians, we look for these things. So if you bring your child in to be assessed, or just to even have a discussion because you're suspecting that your child might be exhibiting signs of ADHD, we ask some questions to see, are there risk factors in this situation? So we know that if a child has family members, especially close family members, who have a diagnosis of ADHD or have characteristics that are associated with it, because sometimes older generations never receive that diagnosis, so it doesn't mean they didn't have it, but it might not have been identified. Looking at problems with the central nervous system at key moments in development, such as having low birth weight, prematurity, things with seizures, things like that can give us a clue that maybe we'd be more likely to see symptoms of ADHD. The environment, if kids are in an environment that is very chaotic, unstructured, and they're not receiving kind of age-appropriate supports, sometimes we see that ADHD is more likely to be more present or be more obvious. We know that kids who have their mother, there's a maternal history of drug use, alcohol use, or smoking during pregnancy, And also we know that kids are more likely to show symptoms of ADHD if they've experienced or witnessed domestic violence. So they don't have to have experienced it themselves, just witnessing it is enough to contribute to those symptoms. So it's important to consider kids' background history in the process. Now, if a child doesn't have a family history of ADHD, it doesn't mean that we say, nope, that's not it, because sometimes it can be, because it is a neurological condition, it can be something that developed separately from the environment or genetics. So, but it's just something that we look for. A lot of times when I interact with parents and they tell me about their kids and I say, hey, is this something, do you relate to this at all? And they'll say, oh, yeah, he's just like me. Or, oh, I was exactly the same way as she is. So oftentimes, even if there isn't a diagnosis there in an older generation, there's characteristics that are pretty similar. So let's talk about how we tend to diagnose ADHD. Now, I do want to remind you, I am a former school psychologist, so I was part of the school teams when kids were brought to our attention that they were showing symptoms of inattention, hyperactivity, or impulsivity, especially if it was impacting their academic or social or behavioral performance. I was part of the team that would help determine whether or not those symptoms might be present and whether or not a parent might want to seek out an additional medical diagnosis. So once again, I mentioned that ADHD is a neurological condition. It really is important that it be diagnosed by a qualified professional. So by that, it could be a physician, it can be and also a physician is a neurologist or a psychiatrist. Those are also physicians. But it could be by a clinical social worker, by a licensed psychologist, a school psychologist. It really needs to have somebody who's well-trained in how to look for these characteristics and can show it through, over a period of time in multiple settings. We wouldn't just say that our child has ADHD at church because every week at church they have a million wiggles and they can't sit down and they do impulsive things. We do need to see that there's symptoms across settings. So we might see characteristics at school, at home. We might see impulsive behavior in multiple settings, maybe out in the community. So we look for that when we consider a diagnosis. And it's also important to recognize that should your child receive a diagnosis and you as the parent decide to consider medication as a treatment option, you have to go to the professional who's able to prescribe medication, which typically is a physician. So that would be a pediatrician, a psychiatrist, or a neurologist most typically, or a developmental pediatrician. So there isn't like a magical test that diagnoses ADHD. But there are assessment tools, and we tend to look for ADHD in the process of doing an overall comprehensive assessment. So we might look at the child's cognitive abilities, look at their memory, executive functioning skills. We do a lot of self-reports. And by self-reports, I mean not only might the child be able to weigh in, especially if they're older, but we're asking for parents and teachers and other significant people in the child's life to report whether or not they've observed certain symptoms in the child's day-to-day setting. So really the process of ADHD diagnosis oftentimes is just based on observation. And even though there is some diagnostic assessment tools that we use to look at the child in a comprehensive way, it's really important to understand that it's not like there's a blood test or an MRI or something specific that we can say, yep, this is definitely what it is. So the thing is with ADHD is sometimes the symptoms of ADHD can be caused not by a true ADHD diagnosis, but they could have some other health condition or mental health condition that is resulting in symptoms that look like ADHD or resemble ADHD. So the really common one that I just want to mention that I talk about all the time is kids who have a significant sleep deficit. So whether or not they have a full-out sleep disorder or they're just a kid who's chronically operating on a sleep deficit, these are kids who are more likely to struggle to concentrate. It's hard to stay focused. They're more likely to look hyperactive or overactive. Their coping skills might be lower. They might be quicker to whine or cry or have a tantrum. And sometimes that can look like symptoms of ADHD. So as the professional who works with kids who are demonstrating these symptoms, it's really important for us to consider what other things could be going on here that could set the stage for kids to show these types of symptoms. I know there was a study out, this was a while ago, talking about kids who experience chronic migraines can often exhibit symptoms that look like ADHD. And if you think of the treatment process, how we would treat migraines would look very different than how we were treating a child who truly has ADHD. So it is really important to make sure that you're examining what other factors could be present. I'll give you another example. So sometimes kids in the school environment will be really struggling with something academically, like maybe they even have a learning disability. And I'm just going to say in reading for this example. Well, if reading's difficult, they're having a hard time understanding the sounds relating to learning to read. They're struggling to decode, they're struggling to remember things that they've already learned. So maybe their memory is looking impacted. And these are kids, when it's hard to do something, it's going to be more difficult to concentrate, remain focused, not get silly, not have avoidance behavior where they try to get out of doing that task. So maybe they break some rules in order to be asked to leave the table. So in that situation, it might be that there's an underlying learning disability, let's just say in reading, and how they're coping with it results in them having symptoms that look similar to ADHD. So it's just something that we have to consider as clinicians and as parents when we consider whether or not a diagnosis of ADHD is appropriate. We also know that kids who've experienced trauma, and I mentioned domestic violence specifically, but other types of trauma too, can have an impact on a child's brain so that they exhibit symptoms that look like ADHD. It is important, and I think that professionals attempt this, to make sure that we're using a universal standard or a universal definition of ADHD so that we can try to all be on the same page when it comes to diagnosing kids. So we tend to use the American Psychiatric Association's Diagnostic and Statistical Manual. Right now we're on the 5th edition to help diagnose ADHD. But sometimes, we can see atypical cases of ADHD too. And so that can result in the need to provide care that's even more nuanced for kids. So this is I just wanted to show this slide briefly. This is the DSM5 diagnostic criteria for ADHD. And as you can see, they have sectioned out inattentive type, hyperactive impulsive type, and then additional requirements for diagnosis, that symptoms need to be present prior to the age of 12 years, and that the symptoms are not better accounted for by a different psychiatric disorder. So we can see that this is an attempt to have some clear criteria. And if you look closely, you can see that under inattentive, it talks about poor listening, misplaces items, struggles to complete tasks or activities, gets easily sidetracked, is forgetful, short attention span. And then it goes into hyperactivity, into an impulsivity, where it talks about being very fidgety, restless, often appears to be driven by a motor, overly talkative, difficulty waiting turn, things like that. So parents, in my conversation with them, when they call and they request just a consultation call, sometimes I hear parents describe their kids with either these terms or similar. And that leads me to think, okay, this is something I need to look into. This might be something I have to rule out. As far as academic difficulties, according to the CDC, the average child with ADHD receives lower grades, falls behind in classroom learning, and shows a significant differences between ability and actual academic performance. About a third of these kids will repeat a grade during their elementary school years. And, really this can show a problem in performing rather than actually a problem in learning. So basically is if kids exhibit symptoms that interfere with their ability to interact with their grade level material, of course, that can result in them falling behind. In addition, if they struggle with behavioral symptoms, right? Like sometimes when we think about that impulsivity and hyperactivity, these are kids who struggle to stay in their seat. They might not listen to the rules. They might not pick up on social skills. They might play rough and get in trouble for that. And they can be viewed as being very disruptive. And that in turn can have an impact on their ability to participate and in turn impact their academic achievement. Some things that might intensify ADHD symptoms. So unmanaged ongoing stress. We know that all of us cope less well when we're experiencing a lot of stress. So if these kids, and it could be something like, oh, just the stress of going to school and it's a new school year, or they're trying out a new sport, or it could be something where there's chronic problems at home, a parent who's struggling with addiction, food insecurity, really significant stressors. But if it's unmanaged and kids, it's not being accounted for and kids aren't being supported in the way that they need, that can be something that can intensify ADHD symptoms. Some other things, one of them I already mentioned, is lack of sleep. We know that kids who have ADHD are very attracted and can become easily dependent on technological devices, screens. But that can actually intensify their symptoms. And sometimes it's because of the flashing lights and the overstimulation and the fact that they're just getting really hyper-focused on something on their screen, and they're not getting enough energy out, in the form of physical exercise or getting stimulated in other parts of their brain. But as parents, we have to be really protective of kids' brains and in their development when they have ADHD. We need to do it regardless, but particularly for kids with ADHD. We know that kids who are overstimulated from sights and sounds can end up showing more hyperactivity, irritability, impulsivity, lack of physical exercise or an outlet for their energy, and then just the ADHD remaining untreated. Oftentimes, if kids aren't receiving the treatment and they continue to experience the stressors of it, right? Doing poorly in school, struggling to make friends, then that can contribute to their symptoms worsening over time because they're not developing coping strategies to deal with them. Some things to consider as far as how ADHD impacts a child in the classroom. We know that they're likely to miss academic content. They're likely to miss social cues from both their teachers and peers. They are spending less time on task and doing the assignment or the activity that they've been directed to do. They're more likely to be yelled at or treated impatiently. And this is something that in my work as a therapist, and I work with kids, sometimes I have to overcome or teach them to overcome whatever sort of residual feelings that come from kind of chronically being in trouble. Because these kids, oftentimes look like poor listeners and they're so overactive, it can result in just adults getting frustrated with them or feeling like they have to raise their voice to have this child attend. So these are kids who often, just feel like adults are always yelling. They're more likely to be isolated from peers. And by this, I mean they're more likely to experience being seated apart from their classmates because they're so overactive. They might be very messy and impulsive, have a hard time not interrupting or talking to their neighbor. So they might say, okay, you sit over here, and that way you'll have fewer distractions. They also might be kids who get in trouble and are denied privileges. If their behavior is viewed as misbehavior, it might be, well, you missed recess or you can't play in that game because you didn't get your work done, or they're more likely to get suspended. They're more likely to experience social rejection, and they're also more likely to have symptoms of anxiety, impulsivity, and hyperactivity, and have those symptoms treated as misbehavior versus just a symptom or a product of their ADHD. So I hear parents and teachers, they'll say, well, I think they could control themselves if they just wanted to. And their inclination is to really focusing on punishing that student so that they're hopefully going to sort of straighten out their act and be better behaved. When in reality, and it doesn't mean that kids with ADHD can't sometimes purposely be naughty, but a lot of their behavior feels out of control and they don't have the coping skills to sort of teach their body to be more responsive to the environment around them. Some therapy options. Now, when it comes to best practices in treating ADHD, hands down, we would say two primary things. Behavioral interventions and counseling, and I put those kind of in the same category because they can look different based on the therapist you're working with, as well as the age of the child. And then the second thing is medication usage. So the thing with medication usage is that it's often stigmatized, and parents might reject medication use as an option even before they've had like a consultation discussion with a physician. So in my work, I'm a therapist. I do not prescribe medication. I'm very respectful of the decision that parents make about that. And if I speak to it, it's usually just to encourage parents just to find out the information about it, so that if they decide it's a no, it's a very informed no versus a no that's based on, what our neighbor's experience was or what somebody talked about on social media, or potentially information that isn't even true or relevant to your child. So I always encourage parents, to let them know this is part of best practices in treatment. It may not be appropriate for your child, but at least make sure you're speaking to a physician who gets to know your specific child and can determine whether or not it should even be part of the treatment plan. Counseling and interventions, and the counseling or the behavioral therapy or the behavioral interventions, the focus of that is to really focus on strategy development and coping skills to reduce symptoms. So just to give you a little bit more detail about that, when I work with kids with ADHD, oftentimes we focus on executive functioning skills. How do they plan their behavior? How do they prioritize what tasks to work on? What can they do to keep their body calm when they're feeling escalated or they're feeling like their temper is getting the best of them? We might talk about anxiety management. And the same thing with parents. When it comes to counseling or behavioral therapy, it's something that it's essential that parents be invested in also, because it's not where we're not expecting kids like, okay, kid, you just need to change and not be ADHD anymore. A lot of how kids with ADHD respond to their environment is based on what the adults in the environment do to set them up for success. So if we have a teacher who has kids oftentimes move their bodies and have a chance to get out their wiggles, then that is an accommodation the adult needs to make so that child can benefit. If we have a parent who's teaching their child very specific organizational skills, so they're not missing a bunch of assignments, losing papers, and getting unnecessary zeros. Is there things we can do to teach your kids to wait their turn or not shout out or not interrupt? How do we teach our kids with ADHD to hone in on the important parts of the conversation where the details matter? Because it might be impossible for them to listen to 100%. So how do we teach them to listen to the significant parts so that they can follow through? There's a lot of cueing and strategies that these kids really benefit from, and oftentimes parents benefit from them too. It makes their house more organized. It makes things a little more predictable. But in order for a family with ADHD to benefit from that, this type of therapy needs to be worked on together. So when I work with families, it's very collaborative with the parent as well as with the child, depending on the age of the child. So this slide just talks, it was a really great grab from the American Academy of Pediatrics, and it talks about what is behavioral therapy. And so some of these things I've already mentioned is that our goal with behavioral therapy is to encourage positive behaviors and then, try to extinguish unwanted behaviors and really monitor where you're seeing progress. So with parents that I work with, and you see this in schools a lot too, is we collect some really basic data on what the child's behaviors are, good and, troublesome. And we see what are they responding to? What are some triggers we should be aware of? What types of reinforcers are helpful for them to stay motivated and on task? And once again, as it notes here, it's involving both the parents and the child whenever is possible. And it's really important to find a therapist who has experience in working with kids with ADHD. And if kids are real little, if we're working with a 2 or 3-year-old, they might be able to participate in some play therapy, which is a type of therapy that's very specific for the younger age group. But it might be at these younger ages, I work much more directly with the parents, and then they're creating a home and a communication style with their child to help them over time develop more and more coping skills. So working with psychologists, licensed counselors, licensed social workers, these are all individuals who can be really supportive of a child with ADHD. Now, one professional that is not mentioned on this slide that I did want to give a shout out to is occupational therapists. Occupational therapists do a fantastic job teaching kids with ADHD to be aware of their sensory environment, because these are kids who are oftentimes either underreactors to their environment where they need a lot of stimulation to feel it. So for me, having somebody tug my hair like this just feels like somebody tugging my hair. To an ADHD kid, for them to experience that same feeling, they might need to really have their hair pulled out, because their understanding and interaction with their sensory environment is different than a child who doesn't have ADHD. So sometimes these kids will play really rough. They have big, movements. Everything feels over the top, like kind of aggressive. And that can factor in to the work that an occupational therapist does to support kids in their sensory development. They also help kids work on other things too, but that is, as a clinician, one of the main ways that OTs really make a difference in the care of kids with ADHD. So we talked about a bunch of things today, looking at what is ADHD, what are some kind of basic characteristics of it, as well as some ways that those children can be impacted in the classroom setting, and some good information to know about diagnosis and some treatment options. So I really appreciate you listening. I think we're going to talk a little bit more about this topic in future webinars, because it's so relevant to so many families. And we talked about those statistics at the beginning of the presentation about how it is a significant amount of kids in the school environment are exhibiting signs of ADHD. So I think I want to keep this conversation going. So as you listen to this, if you have a question, please visit www.drterryegan.com. Make sure to leave a comment or a question, and we can address it at a later time. Once again, here's some other ways that you can contact me. And I really do encourage you to tune in every week to our parenting podcast called One Day You'll Thank Me. I do co-host it with my teenage daughter, and we right now are in the process of finishing up our second season, and we're going to take a couple weeks off, and then we're going to roll into our third season. So thank you so much, everyone. I appreciate you being here today.